DrFirst helps providers walk before they run. These days, most doctors have a practice management system and paper records. But the government is pushing providers to begin upgrading to electronic health records. By creating both penalties like MIPA and incentive programs like Meaningful Use and PQRS. Despite this carrot and stick approach, many doctors are simply not ready to take the plunge. By giving doctors a modular way to meet meaningful use and providing attestation guidance, DrFirst gives providers a simple and affordable way to transition their practice to take full advantage of the federal incentives and evolve at their own pace using the Arcopia e-prescribing and meaningful use platform. When practices are ready to take the final step to an EHR, DrFirst offers a free online EHR advisor tool to help them find the most suitable healthcare technology for their practices. Also, DrFirst sets providers up for success with a smooth data migration to over 200 EHR partners who utilize DrFirst's award-winning e-prescribing technology. DrFirst helps hospitals manage meds. Hospitals are looking for an efficient and economical solution to meet Joint Commission requirements for medication reconciliation while also increasing cost savings for their facilities. But frequently, hospital staff find that patients are poor historians. Their caregivers have limited knowledge, and they provide incomplete documentation. These challenges result in a manual process of obtaining medication history from multiple sources, which is both challenging and time-consuming. With DrFirst Arcopia AC, hospitals now have access to their entire community of patients' medication history data in seconds, thereby allowing the hospital staff to quickly compile an accurate and detailed medication list for a more complete picture of the patient's current medication information. These workflow improvements also maximize patient safety by providing formulary and clinical alerts at the point of care for drug, and drug allergy, as well as other conflict checks. With DrFirst, hospitals can provide a higher level of patient service and safety while saving time and money through the efficiency of electronic medication orders and formulary checking. EPCS, Electronic Prescribing of Controlled Substances for Everyone. Since 2009, DrFirst has been deeply involved with piloting EPCS to deliver a simple, secure, and affordable way to send controlled substance prescriptions legally. In 2011, DrFirst became the first vendor in the nation to meet the difficult and strict certification and auditing requirements set by SureScripts, the Interim Final Rule (IFR) set by the Drug Enforcement Administration (DEA), and the identity proofing requirements set by NIST. DrFirst realized that the inability to prescribe controlled substances electronically was one of the biggest barriers against achieving positive clinical outcomes, greater information exchange, increased efficiency, and cost savings that could be possible with greater nationwide adoption of e-prescribing and electronic health records. So instead of providing e-prescribing of controlled substances exclusively to their own clients, DrFirst has invited all electronic health record vendors to utilize the EPCS Gold platform and offer controlled substance e-prescribing to their clients. By connecting to this platform, vendors avoid the developmental, certification, and auditing obstacles and costs required to successfully and quickly begin offering EPCS to their users too. DrFirst promotes positive patient outcomes. Research shows that utilizing health IT can help to prevent non-adherence to medication by patients with chronic diseases, which can save thousands of lives and greatly reduce escalating healthcare costs in the U.S. DrFirst's Patient Innovations Division offers behavioral health coaching and medication adherence solutions that improve patient outcomes by minimizing gaps in care and patient non-adherence to medical treatment. DrFirst's new Patient Innovation Platform promotes positive patient outcomes by providing evidence-based solutions and electronic tools, health coaching, and patient support to close the information and communication gap between healthcare provider visits. DrFirst's Patient Innovations Platform is available to all DrFirst clients and EHR vendors. It is designed to help providers improve patient health outcomes, while also meet patient education requirements for meaningful use. It takes moxie to tie together the entire healthcare industry, but DrFirst has found a simple way to break through the islands of care by connecting all the stakeholders in a groundbreaking way. Stay tuned.